Thank you, Amanda. His Excellency, Honorable Alice Mwahome, Cabinet Secretary, Minister of Water, Sanitation and Irrigation, Her Excellency Margaret Whitman, U.S. Ambassador, Representative of COG, Honorable Badilisha, Governor Nyandarua, UNICEF Kenya Country Office representatives, distinguished guests, ladies and gentlemen. My name is Susan Mutua, Head of Department of Public Health in the Ministry of Health. I happen to be privileged because I also happen to be a technical officer in this field of water and sanitation. So I know every single thing that the counties go through, the communities out there go through. And in this case, when we are having the issues of cholera, it is basically about water and sanitation. So actually, the launch of this plan is an advantage for us, and I believe it's going to take care of some of those issues that we have been going through. Just to mention some of the issues that we've been going through in our day-to-day work, the number one issue is unavailability of water. Then secondly, unavailability of safe water. Number three, sanitation facilities which are not ideal. Number four, those sanitation facilities, the few of them, they are not ideal, and then again, we also don't have water to maintain those sanitation facilities. Number five, county community empowerment through technical supports and budget for implementation of these activities. So I believe this event is timely, and it's going to go a long way in handling some of these issues that we are going through. I'm here representing the Minister for Health, Madam Susan Wafula, for this particular launch, and I would like to go through her speech verbatim. Ladies and gentlemen, I am delighted to join you today and witness this auspicious occasion, the launch of USAID Kenya High Priority Country Plan. As a ministry, I wish to express my humble recognition and appreciation for being part of this process. I wish to reiterate and reaffirm that this is a noble plan, since safe drinking water, sanitation and hygiene are crucial to human health and well-being. Safe wash is not only a prerequisite to health, but contributes to livelihoods, school attendance, dignity, and helps to create resilient communities living in healthy environments. Global access to safe water, adequate sanitation, and proper hygiene education can reduce illnesses, deaths from diseases, leading to improved health, poverty reduction, and socioeconomic developments. According to WHO 2018, poor hygiene, inadequate quantities and quality of drinking water, and lack of sanitation facilities cause millions of the world's poorest people to die from simple preventable diseases each year, women and children being the main victims. It is important to note that in Kenya, only 28% of rural and 32% of urban Kenyans have access to improved sanitation. This is as per GMP 2017. About 6 million Kenyans have no access to any form of sanitation facilities and practice total open defecation. About 24 million use unimproved sanitation facilities or share latrines. Many counties have not seen open defecation and raw sewage discharge into the environment as a public health concern. Therefore, it remains unattended to. Malnutrition and stunted growth is on the rise in many counties and is mainly attributed to poor sanitation and hygiene as one of the underlying risk factors. Every year, many counties are reporting cholera outbreaks, as we are going through right now in about 16 counties. The country loses 27 billion every year due to poor sanitation. And this is a lot of money just going through the drain when we are able to do something about it. Ladies and gentlemen, what we are launching today is key to us in the health sector, since water, sanitation and hygiene and health are linked in many ways, and as a ministry we give high priority to the same. Access to safe drinking water is important to health, since contaminated water that is consumed may result in waterborne diseases including cholera, typhoid, dysentery, viral hepatitis, and other diseases that cause diarrhea. Without adequate quantities of water for personal hygiene, skin and eye infections spread quite easily. Water-based diseases and water-related vector-borne diseases can result from water supply projects that inadvertently provide habitats for mosquitoes and snails that are intermediate hosts for parasites that cause malaria, schistosomiasis, lymphatic filariasis, onchocerciasis, and Japanese encephalitis. Drinking water supplies that contain high amounts of certain chemicals like arsenic and nitrates can cause serious ill health. Ladies and gentlemen, it is very important to note that the benefit of improved sanitation extend well beyond reducing the risk of diarrhea, dysentery, cholera, typhoid, and hepatitis A, and this includes reducing the spread of intestinal worms, schistosomiasis, and trachoma, which are neglected tropical diseases that cause suffering of millions. Reduce the severity and impact of malnutrition. Promoting dignity and boosting safety, particularly among women and girls. Promoting school attendance is particularly boosted by the provision of separate sanitation facilities and potential recovery of water, renewable energy, and nutrients from fecal waste. So we are able to tell that actually there are so many interlinked areas between sanitation and health, including also education. Because once you're healthy, you're able to attend the school and you're able to become a beneficial person in the community. WHO study in 2012 revealed that for every $1 US investment in sanitation, there was a return of $5 US in lowering health costs, more productivity, and fewer premature deaths. So we have every reason to plan on improvement of sanitation. A lot of emerging and emerging diseases like COVID-19, Ebola, H1N1 can also easily be prevented through wash. And we were able to tell during this time that we were really emphasizing on hand washing during the height of COVID. We were able to report very few cases of diarrheal diseases even in our hospitals. So that goes in a long way to show that simple sanitation activities go a long way in improving health. Ladies and gentlemen, in Kenya, available statistics show that a significant proportion of rural communities, that is around 11.3%, practice open defecation and have no access to any form of sanitation facilities. 90% of open defecation is taking place in 15 counties, which we categorize them as high burden counties, namely Turkana, Samburu, Marsabit, Mandera, Wajir, Garissa, Tana River, Kilifi, Kwale, Narok, Baringo, Isiolo, Homabay, Kajiado, and West Pokot. In order to eliminate the risk of emanating from open defecation from the 15 high burden counties, Ministry of Health, Ministry of Water, UNICEF, and USAID, and Government of Japan in collaboration with county governments and other development partners have come together and launched the Kenya Sanitation Alliance, the KSA 2021, which is used as a vehicle to propel issues of hygiene, sanitation in most impoverished counties. To fast-track achievements, Ministry of Health has initiated a sanitation and hygiene competition among counties which runs from January to December, and annual Kenya Sanitation Week event which is held every end of the year, and best performing counties and runner-ups given an award to appreciate their achievements. We just held one of these around last month, and eventually we intend to roll it out to the 47 counties so that we are able to improve sanitation, because apart from these 15 counties, it doesn't mean the other counties are where we want them to be. So eventually we want to look in all the other counties so that we are able to have a healthy competition which will take us far in terms of sanitation. Ladies and gentlemen, various studies and outbreak investigation on cholera conducted in Kenya in recent years between the IDSR, Ministry of Health, and CDC have shown counties with higher prevalence of open defecation identified as being at higher risk of waterborne diseases, including cholera outbreaks. In order to overcome the open defecation menace, the country is now finalizing the National Multi-Sectoral Cholera Elimination Plan, which is geared towards cholera elimination in Kenya and is aligned to the ending cholera. That is a global roadmap to 2030. I would like again to reiterate that among the 15 counties that are practicing open defecation, more than half of them are experiencing the current cholera outbreak. The purpose of the plan is to guide implementation of cholera-related activities and interventions for Kenya to achieve cholera elimination by 2030. The plan also identifies the cholera hotspots and high-burden areas in the country where targeted interventions will be carried out. Wash activities are identified as key interventions to be undertaken by stakeholders. Ministry of Health acknowledges and appreciates that USAID partnership with the ministry at both levels of government is not new, and we have continuously partnered together in the field of, but not limited to, maternal and child health, immunization, nutrition, TB, HIV and AIDS, and malaria. In the area of WASH, we have been closely working with UNICEF within the context of Kenya Sanitation Enabling Environment Project, KSEP. As you are all aware, health is the devolved function of the county government, with the national government mandated mainly in ensuring counties have requisite capacities, policies, strategies, roadmap, and development of appropriate monitoring and evaluation tools. And this we have, as a national government, we have been able to develop. So now it's upon the counties to domesticate, as we also try to find any technical assistance that we can offer to the counties. As part of enabling national government to meet some of its mandates, USAID through UNICEF was able to support the review of MOH ODF roadmap, review the rural sanitation protocol, and upgrade the real-time monitoring web-based system. With support from USAID, we were able to set up 12 county sanitation hubs and 2 national sanitation hubs, which are based at the Ministry of Health and another one at the Ministry of Water, Sanitation and Irrigation. Under the Kenya Sanitation Alliance, USAID has been supporting 5 counties in the accomplishment of the improved sanitation, namely Kilifi, Narok, Homa Bay, West Pokot, and Turkana. USAID also supports the national government in the area of capacity building to the counties, supportive supervision, and quality assurance. Ladies and gentlemen, I'm also aware that USAID closely works with our sister ministry, Ministry of Water, Sanitation and Irrigation, and MOH acknowledges and appreciates the enormous good work done by our sister ministries and urge you to support them more, for them to deliver more services in the field of WASH, because that will be in support of health. I know that the services they will undertake will significantly improve the livelihood of Kenyans and hence positively impact on health outcomes. The area of water security, water resource management, governance, and sanitation are key in sustainability of WASH services. MOH is pleased to be part of this event of launching the USAID Kenya High Priority Country Plan, which will be implemented in the next 5 years. My ministry welcomes the initiatives, commends and promises to support and ensure accountability of any activity that falls within its scope under this plan. I wish to encourage other sector actors to support this noble way of working together. As I conclude, I wish to recommend and emphasize the need to focus more on the most disadvantaged communities within your target areas, including informal settlements, that is the slums, institutions like schools and healthcare facilities. There is need to implement WASH services holistically so as to achieve the desired objectives. There is equally the need to monitor impact and document emerging best practices. I wish to appreciate the invite, and it's my prayer that all of us will positively contribute to the achievement of the intended plan. May God bless you all.